Have you ever wondered how multiple sclerosis, also known as MS, affects pregnancy? This is a question that has puzzled many minds. To understand this, we first need to grasp the basics of MS. Multiple sclerosis is a chronic illness of the nervous system where the immune system mistakenly attacks the protective covering of nerve fibers in the central nervous system. This can cause a wide range of symptoms, which may include fatigue, difficulty walking, numbness or tingling, muscle weakness and spasms, among others. Now let's bring pregnancy into the equation. It's a phase of life when a woman's body undergoes significant changes. But what happens when a woman of childbearing age has MS? Well, interestingly, research suggests that pregnancy might actually reduce the number of MS relapses. Yes, you heard it right. Pregnancy could potentially have a protective effect against MS relapses. So, does MS affect pregnancy? And how does pregnancy impact MS? These are intriguing questions that we'll explore in the upcoming segments. Now, let's delve deeper into the relationship between MS and pregnancy. So, how does multiple sclerosis impact the course of pregnancy and vice versa? Well, let's delve into that. You might be surprised to learn that having MS does not necessarily increase the risk of pregnancy complications. In fact, a lot of women with MS have normal pregnancies and healthy babies. Now let's flip the coin and look at how pregnancy might influence the course of MS. Some research suggests that pregnancy could lead to a temporary reduction in relapses. Yes, you heard right. This is because of the natural alterations in a woman's immune system and hormone levels during pregnancy, which can help to suppress MS activity. However, it's important to remember that MS is a highly individual disease, and everyone's experience can be different. Some women might see no change in their MS symptoms during pregnancy, while others might see improvements. But what about after the baby is born? Let's explore that next. What happens to women with MS after they have given birth? This is a question that weighs heavily on the minds of many expecting mothers with multiple sclerosis. The postpartum period is a time of significant change and adjustment, and for women with MS, there may be an additional layer of concern. Research suggests that there might be an increased risk of MS relapses in the first 3 to 6 months after childbirth. However, it's important to note that these relapses do not contribute to long-term disability. They are typically short-term and manageable, especially with the right support in place. Speaking of support, it's crucial to plan for postpartum assistance. This could be in the form of medical professionals, family, friends, or even support groups. Having a strong support network can make managing postpartum life and MS more manageable. In conclusion, while the postpartum period may come with its challenges for women with MS, it's important to remember that these challenges can be effectively managed with the right planning and support. So, pregnancy and postpartum can be managed effectively with MS. But what about medications? Are there any concerns regarding MS medications during pregnancy? You may wonder. It's a valid question, and one that requires careful consideration. There's a plethora of MS medications available, each with its own set of benefits and potential drawbacks. Some of these medications may be safe to use during pregnancy, while others might pose risks. Navigating this complex landscape can be challenging, but remember, you're not alone. It's crucial to have open and thorough conversations with your healthcare provider about any medication plans well before you consider becoming pregnant. This way, you can make an informed decision that takes into account your health, the course of your MS, and the well-being of your future child. And let's not forget, MS doesn't define you, nor does it dictate the success of your pregnancy. You are more than your condition, and your journey to motherhood is as unique as you are. Remember, every pregnancy is unique, and so is every woman's experience with MS. It's important to work closely with your healthcare team to ensure the best possible outcomes for you and your baby.